So today's video is on assessing shoulder pain, specifically looking at subacromial impingement, which is the umbrella term for rotator cuff tendinopathy, bursitis, or tear in the rotator cuff. So there's 5 tests that the physio might use to assess this, and I'm going to show you how to do the equivalent on yourself. So this is the cluster of tests done by a paper, seen in a paper, Michener and al. In 2009. We looked at the reliability and diagnostic accuracy of these 5 tests and came up with a cluster. So if you test positive for 3 out of the 3 or more out of these 5, then it's considered a positive test or a positive outcome, that it's likely that you have some subacromial impingement. So it's that little space underneath what we call the acromion where you can get compression. So let's go through the 5 tests. The first test we're looking at is Neers test. So the physio would stand by, usually kind of behind you, and then just raising your arm up passively. So you can do the same thing by just but let's bring it into internal rotation and compress that space and rotate the humerus so it compresses that space. And then bring the hand up in front. So if you're getting pain with this movement, that's considered a positive test. So that's number 1. Number 2, we're what's called Hawkins Kennedy. So again, the physio would bring you into this position and bring you into internal rotation, again closing that space. So if we pop one hand, so I'm doing it on my right shoulder, okay? And then I'm coming into internal rotation. And again, if it's recreating your pain, again, that's a positive. Number 3, we've got painful arc. So coming from the side, so coming this way, yeah, if you're getting leading with the thumb, yeah. So if you're getting pain anywhere between, I think, about 40 degrees and 120, so in this region, that's considered a positive test. That's the painful arc. So about 140 to about 120. Generally no pain up here and no pain in this 0 to 40 range. So again, if you're getting pain there, positive test for number 3. Then we've got what we call empty can. So this one's a bit more difficult. So that's full can, that's empty can obviously. So what you want to do is the physio would generally resist this movement, but doing in what we call the scapular plane. So that's straight out in front, that's straight to the side. So it's kind of roughly in between. So again, turning over. You could get your colleague to just apply resistance and you push up against it. Or you could grab a door frame. So I got a door frame here. Yeah. And I'm gripping the door frame and trying to pull up. So again here. I'm trying to pull up. And that's number 4. And number 5 is what we call resisted external rotation. So again, keep your elbow into your side, hand here, and again the physio would bring their hand here and you'd push against. So that's shoulder external rotation. So again here, and push out. And again, you need to test positive for 3 or more. And again, less than 3 is a negative. Okay, so that's it for today. Again, a lot of time you're best going to physio or chiropractor or osteopath, some even sports massage therapists or rehab physicians or therapists, to get a diagnosis and patient-centered treatment plan. I may do so. Go and look at my other video on some of the exercise, some of the general kind of generalized rehab that I've done in another video on shoulder impingement. And comment, like, and share. Thanks. Bye.